Hi everyone, it's Anita Lambert, your holistic health physio. And today I wanted to share with you a common question that I receive, and that is, should I or can I see a pelvic health physiotherapist while I'm pregnant? And the answer is a definite yes. So coming in for an assessment during pregnancy can help you resolve or prevent common pelvic floor and core issues that we are told are just a normal part of pregnancy. But they can just be a sign that your pelvic floor and deep core aren't working as well as they could. So some symptoms you may be experiencing are leaking urine, whether you're coughing, sneezing, laughing, lifting, exercising, you don't quite make it to the washroom on time, or the feeling that this may happen. As well, if you're experiencing any internal pelvic pain. So that's pain internally, whether you're having intercourse or during a pelvic exam, as well as other types of pelvic girdle pain. So pain around the pubic symphysis, pain into the hip, pain in terms of the SI joint or the tailbone or the low back. As well, if you feel pressure in terms of your pelvis, so pressure at the bottom or feeling like something may fall out of your pelvis or bulging around the opening, as well as doming or tenting along the center of your abdomen. So these can all be signs that your pelvic floor or core may not be quite working as well as it could, and seeing a pelvic health physiotherapist can be quite helpful. So in terms of when you come in for an assessment and you see a pelvic health physiotherapist, we go through a detailed history. So finding out past injuries, past surgeries, any health conditions, any other types of treatment you've received for this or for any other concerns in the past, as well as we talk about your upcoming birth. So your preferences, your care provider, what your support is like during pregnancy, and your support at your birth as well as postpartum. And after we go through your history, we take a detailed look at your posture. So in standing or lying and in various positions, and can give you tips on how you can make a couple of changes that may help your core support you better in those positions. For the internal portion of the pelvic health assessment, initially we look externally. So we're looking to see in terms of if there is any tenderness on any of the spots around the opening, or if you've previously had a birth and have had scarring, vaginal scarring, we'll take a look in terms of if there's any tension around the scar. Internally, we initially go vaginally, and we're pressing around just certain spots in the pelvic floor, and you're letting us know if those spots are tender, because that can be a sign that actually your pelvic floor muscles, like any other muscle in the body, can actually be tense or be a little bit tight. So we can help you work on releasing that tension, which can be helpful for birth, but also helpful to do before you start to strengthen those muscles. We'll also be able to check the position of your bladder, uterus, and rectum internally to feel if anything has started to lower, which could be a sign of prolapse. And we also test your strength internally, so to see how your muscles work together, how strong they are, as well as their coordination with different movements. And so that can guide us in terms of helping to resolve or prevent the issues that you're looking to gain, or your goals that you want to accomplish. We also, in terms of the external part of the assessment, if you've had a cesarean birth, we will take a look at your scar, because tension around the scar can also contribute to your deep core not working as well as it could. So we'll be able to help you address that, as well as we take a look at your midline along the abdomen. So we'll take a look to see if you have a diastasis, so an ab separation, and how best we can help guide you in healing that after birth. So that's a little bit about what happens during the assessment. When to come in. So some women ask, is it too early, too late? I see women as early as their first trimester, as well as late as 39, 40 weeks. So it's really never too early or too late. Even coming in prior to pregnancy can be helpful to check how your core canister, your deep core, is working to create a solid foundation for when you're pregnant. So at any point during pregnancy or before can be a great time. Also seeing a pelvic health physiotherapist. Every physio is a little bit different, but I really enjoy providing education to clients about labor positions, birth positions, how to use your breath during birth to really help release and relax your pelvic floor, as well as tips you can start using after birth to help restore your deep core efficiently, to then help you later on getting back to all of your activity goals and health goals. So if you have any questions or comments, feel free to let me know.